pre-existing condition, they won't cover you. If you're too fat, you're out. But how about if you're too skinny? You're out. How about if you're too healthy? It's true. A gentleman in Florida, healthy all his life, 55, maybe now I should get some health insurance. But he was robust, everything worked. He'd never been to a doctor. Applies for health insurance. Guess what happens? He's rejected because they couldn't find any medical records on him anywhere. We laugh about that, but boy, if you're the one with a pre-existing condition and you need health insurance and you can't even get health insurance, let alone pay $1,300 or $2,000 a month, you can see how desperate the situation was becoming for so many Americans. The last bullet point, uncompensated care. The hospitals in this region, whether it's Seton, Mills Peninsula, do we have any others? Kaiser, all of them end up, not Kaiser so much, but all of them end up shifting the cost of providing health and care to people who have no insurance to those that have. That's why your premiums are so high. Because people who come into the emergency room are not turned away. That is a federal law. We are never going to turn anyone away from the emergency room. So when they're provided care, they don't have health insurance, how does the hospital pay for that? How do they pay for the drugs and the x-rays and the MRI, all the things that happen as a result of that particular admission? Gets shifted to those who have health insurance. So $46 million will be saved in what has historically been uncompensated care because everybody, virtually everybody, is going to be covered. Okay, next one. This is particularly for seniors, but if you are a senior, you may be becoming one soon, so you need to know this. Okay, great. The first check applies to everyone. It eliminates the out-of-pocket co-pays for preventative services. Now, I just had a colonoscopy last week. I highly don't recommend. But let me tell you something. That is a preventative service, right? It costs anywhere from, John, you're here. John Ma, you tell us, how much do they cost?
The charges? Probably a few $1,000s.
Yeah, I've heard $1,500 and maybe as much as $2,000. Okay, imagine $2,000, your copay is $400, right? Some people will think twice about having one. If you have $400 coming out of your pocket for just one screening procedure. So, seniors have been paying that copay. Many of you have been paying that copay if you have group insurance that has that kind of a 80-20. No longer are you going to pay for that copay for a preventative screening. Mammograms, colonoscopies, what are some others? Blood
type?
osteoporosis screenings. A physical too. Pap tests, all of those are preventative screenings. So that's a huge benefit to everybody. I mentioned earlier about the $250 rebate for persons in the donut hole. The other great benefit, as of January next year, Medicare patients who are in the donut hole are going to see a cut in their brand name drugs by 50%. There'll be a 50%. Now, leave it to the pharmaceutical industry. They'll jack the prices up until December, but nonetheless, it does provide that benefit. Closes the donut hole by 2020, increases reimbursement for primary care physicians, and encourages training of primary care physicians. This is really critical as we move forward with healthcare reform. There's been a dearth of primary care physicians, and you can understand why. You come out of medical school with a $250,000 debt, and you're going to be a primary care physician where you're not going to be, making the big bucks. And I really am offended when people think doctors make big bucks now. After watching the punks on Wall Street last week, who do nothing in society to improve it. Making the kind of money they're making is so outrageous. So I say to doctors, but primary care physicians are going to be given an incentive now. So medical school students who decide to go into primary care now will be forgiven their entire cost of their medical school career if they provide medical care as a primary care physician in an area that is in need of primary care physicians for a period of 4 or 5 years. So we're really next one deals with waste and fraud in the Medicare system. You know, it is, when people talk about our deficit, what are you doing about our deficit? You really need to get into a conversation about, well, where do we spend our money? And our money in the federal government is spent on entitlements. It's spent on Social Security, Medicare, Medicaid. Those are the big entitlements. So one of the things we have to do in terms of making this pencil out in terms of healthcare reform, and frankly to bring down the deficit, is get rid of the waste, fraud, and abuse in the Medicare system. And we figure that it's about, what, $100 billion a year. It's with a B, $100 billion a year. If you just say, you know, there's waste and fraud in everything and it's 10 to 15%, that's where you're going to come up with that figure. I think it's about, we figured 20%, because it's about a $400 billion program a year. So the president has created an office specifically focused on dealing with abuse in Medicare and the fraud that might be associated. So we'll save some money there. Eliminates overpayments to private Medicare plans. So this is that Medicare Advantage program. Medicare Advantage will continue. You'll be able to stay on Medicare Advantage, but it's going to equalize it for everyone. About 1/4 of the population of seniors was on Medicare Advantage, 3/4 not. And, you know, the federal government was subsidizing Medicare Advantage to the tune of about 14%.